It's time again for Health Monitor, the #1 program that's shows you how to live a life in its healthiest way. To improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Good to be back again. This is your favorite health program, Health Monitor, your guide to good health. I am Ajeni Kefamunjuro Fakayode. And on the program today, we have assisted conception, body care, and health tips. It promises to be exciting. Stay tuned, we'll be right back.
It's Health Monitor, the #1 health show.
How to deal with constipation. Constipation can be treated at home. First, try gentle exercise. Take a short walk each day. Make sure you drink enough fluid. Most adults should try to drink between 8 and 10 glasses of water or non-caffeinated beverage each day. Include fruits, vegetables, and fibers in your diet. Schedule time each day for a bowel movement. If you are still constipated, add some processed or synthetic fiber such as citrusel or pedim to your diet each day. Try a stool softener such as Colace if your stools are very hard. And if you are still constipated, check your symptoms to determine if and when you need to see a doctor.
It's Health Monitor, the #1 health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Good day to you out there. I hope you're having a splendid week. You're welcome to the assisted reproduction part of the show. I am Dr. Ivy and I'm from True Care Fertility Clinic. So today I'm going to be talking about one of the commonest causes of infertility in our environment, and this is tuber blockage. So what is tuber blockage and what are the fallopian tubes? I want us to understand what the fallopian tubes are and what its function is. So the fallopian tubes are a part of the female reproductive system that is responsible for basically movement of the egg. So once a woman ovulates in the ovary, the egg is released into the fallopian tubes, and then the spermatozoa, when she meets with her partner, spermatozoa comes through the vagina to the womb and swims all the way to the fallopian tube, where the egg and the spermatozoa meet themselves. So when the spermatozoa meets with the egg, it goes into the egg and then fertilization occurs in the fallopian tube. While when fertilization has occurred, we call it embryo or a zygote. The zygote now moves back to the womb to attach. So the function of the fallopian tube is basically movement and to nourish that embryo prior to movement back to the womb. So it's very important. It's a very thin tube. It's something like as thin as Indomie, cooked Indomie. A lot of us can understand how thin that can be. So it's really very thin. And so any factor that will cause blockage in the tube will make it to lose its function. When you have the tubes blocked, meaning that the egg and the sperm will not be able to meet. And every woman has 2 fallopian tubes normally. Every woman should have at least 2 fallopian tubes. So you have one in the right, one in the left, and the linking from the uterus, that's the womb itself now, to the ovary. So it's like the arms of the uterus of the womb. So you have the eggs moving through the fallopian tube and the sperm moving to the egg and fertilizing it, then moving back to the uterus. So it's more like a passageway. So what happens if this passage is blocked, and what can block this passage? There are so many things that can be responsible for fallopian tube blockage, but the common ones, you have sexually transmitted infection, gonorrhea, chlamydia, especially in women. most of the male folks, if they have gonorrhea, they usually have difficulty in urinating. So they know that they have gonorrhea and they get it treated. But if they don't inform their partner that they had this, the woman may have asymptomatic disease, meaning that she doesn't have any symptom. She doesn't know she's having gonorrhea, or she may just have pain, a little pain on urination or excess vaginal discharge. But most women may ignore that sensation because it's not as serious as when a man has gonorrhea. So a woman has gonorrhea, it goes up from the vagina, moves to the womb, from the womb moves to the fallopian tube, causes PID, which is a pelvic inflammatory disease, and then you have a whole lot of infection around the pelvic, and then the tubes are involved. After this, the body on its own tries to resolve this infection, and as the body is trying to resolve this infection, you have adhesions. Adhesions is just like a scar. When you cut yourself, you have a scar. But in the tube, inside of the body, it's called adhesion. So you have adhesion forming inside of the fallopian tube. And when you imagine tube as thin as Indomie, if something should, it's easy, it can get blocked very easily. Once it's blocked, then you have infertility in the long run. Any woman with tuber blockage may not be able to, like I said before, the egg and the spermatozoa wouldn't meet. So it's like a fence now, blocking the ability for the egg, of the spermatozoa to fertilize the egg. And this is usually because of common. This is one of the commonest. This is the commonest cause of female infertility in our environment. So, which other factor can cause tuber blockage? You have things like previous surgeries, like mammectomy. You have appendectomy, and you can also have congenital abnormality where they are absent, where you have absence of the fallopian tubes. So in cases like surgery and appendectomy, if someone has a septic appendix, because of the proximity of the appendix to the fallopian tube, you can have infection moving from one organ to the other. So bacteria from the appendix can move to the fallopian tube, and then the healing process, like I said before, because the tubes will get blocked. Then you have conditions like endometriosis as well. Endometriosis simply means the lining of the uterus, that's the lining of the womb. Now, every woman ideally should see her menstruation every month. And then this is a process whereby she sheds off part of the lining of the womb. So if this lining now that you have in the womb goes to the fallopian tube, though you see it commonly in the ovary, but if it goes to the fallopian tube or other structures around, so as she's seeing her period, this lining that is elsewhere is also shedding. And as the body will have it, you have a lot of adhesions forming. Adhesions like scar is a way of healing. And then you have this scar forming everywhere, so you can have the scar forming in the tube, and then it blocks the fallopian tube as well. So these are some common causes of tuber blockage in our environment. So what is the way forward when it comes to tuber blockage? Because a lot of people just think, okay, the doctor told me that the tubes are blocked. What do I do? Should I go for flushing? Should I go for recanalization? Yes, all those are methods of managing tuber blockage. You can tuber flushing, tuber recanalization, but you have very, very low success rate with that. With the outcome of tuber surgery and tuber recanalization, we have low success rate all over the world. And then you have the risk, even tuber surgery can increase the risk of a woman having an ectopic pregnancy, especially a tuber ectopic. So having said this, what is the best solution for a woman who has this kind of challenge? Because now her husband's seminal fluid analysis, the result is okay. She has eggs, but the tubes are blocked. What we do in that case, the best option for a woman like that is in vitro fertilization. Like I will always say, IVF is one of the best things that happened to women and married couples who have challenges. Because in IVF now, what we are going to do, we go straight to the ovary. The ovary is a storehouse for the eggs. A woman's eggs are stored in the ovary because she's born with a fixed number of eggs. And if a woman does not act fast, her egg storage may get depleted over time. So what we do in IVF, we go straight to the ovary, grow her eggs, give her some drugs to grow the eggs. Once the eggs have grown to an extent, we collect these eggs out. Once they have grown to an extent, they are mature. We give them what we call as an injection. We give them to mature the eggs. Then we collect these eggs in the laboratory, bringing out the eggs. We then use her husband's sperm to fertilize this egg. That we take the spermatozoa, use to fertilize the eggs that we have collected. Having done this, we check it after 18 hours for evidence of fertilization. So when fertilization has occurred, we call the developing baby now an embryo. We watch these embryos. At True Care Fertility Clinic, we always ensure our embryos get to the 5th day in the laboratory. And that means for you to be able to get to the 5th day, meaning you have a very good laboratory. Because by the 5th day, the chance of implantation is higher. You have a blastocyst embryo by the 5th day. So we take our embryos to the 5th day, which is a blastocyst. Once the blastocysts have grown, we take the baby now, the embryo, and we transfer back to the uterus of the woman. That's the womb of the woman. We put it back into the womb. So you see now that the process of normal reproduction, where you need the spermatozoa to swim through the fallopian tube and meet with the oocyte, is carried out in the laboratory. So now in the laboratory, we take out the oocyte, that's the woman's egg, the eggs, and use the sperm directly to fertilize the oocyte. So we don't need the fallopian tubes when it comes to in vitro fertilization. So it's a very good thing. So every woman out there who has tuber problem, the earlier you come, the better. Rather than looking for a solution that you may not get, some women believe, okay, is there any drug that can treat tuber blockage? No, there is no drug that can treat tuber blockage. Like I said before, the tubes are really, really thin. And when you have anything obstructing them, it's really difficult for you to treat it. Thank you very much.
It's the number one health show.
Banana. These sweet delights have more potassium than most fruit and may help lower blood pressure levels. Did you know people with rubber latex allergies may also be allergic to bananas, since the two come from similar trees and share a common protein?
It's the number one health show.
Welcome to Body Care segment. I have with me in the studio Dr. Vincent Abimbola Adekoya. He's an otolaryngologist, an ENT specialist, ear, nose, and throat specialist. Doctor, welcome to the program, Health Monitor, as your guide to good health.
Thank you.
To start with, let's discuss about ear diseases like tinnitus, dizziness. So some people will tell you that their hair is ringing, their hair vibrates. Is it a psychological thing or just a perception?
Thank you. As some specific symptoms, which are ear discharge, what I just mentioned now, tinnitus. That is noise in the ear.
Noise in the ear.
Yes, noise in the ear, pain in the ear, dizziness, and speech disorders. Because some people who doesn't hear may not be able to develop speech. So these are the symptoms of ear diseases.
So explain to us more about the tinnitus.
Yes.
Ringing in the ear. Explain more. Is it a psychological thing or
noise in the ear, which is known as tinnitus in medical terms, signifies that there may be problem in the outer ear, middle ear, or inner ear. When somebody's ear is making noise, it means that in about 60% of people who have noise in the ear, there may not be any problem, anything causing it at all. But about 40%, you see a problem either in the outer ear, middle ear, or inner ear, because our ear has 3 parts: outer, middle, and inner. So, like somebody that is being slapped now, the ear may be making noise. Somebody is having wax in the ear may be making noise. Somebody who is having discharge in the ear may be making noise. Somebody is having dizziness, is having some form of a disease affecting the inner ear can be making noise. But in some small about 60% of people, the cause of the hearing loss is not there. There's nothing causing this at all. After you must have investigated the whole ear. So such people, you have to tell them, look, don't put all these things to your mind, so that a lot of them, they can go ahead and have psychiatric problem.
Okay.
They can be going from one hospital.
Which is very, very possible.
Yeah, they can be going from one hospital to the other, one babalawo to the other, one church to the other. They keep on going around, and they even think that their enemy is after them.
After them.
So, but after they have examined and diagnosed properly, you tell them that look, there's nothing causing your hair. Just you can take some.
It might be due to piling up of wax.
Yes, yeah, it can be due to piling up of wax. It can be due to discharge from the hair. It can be due to trauma to the hair. Some people are always putting earphone to be going around and everything. Later, it's damage their hair, and they can decide.
That can equally damage the hair jaw.
Yes. And people who work in some the communication industry who always wear ear sets. All these things. When you have an effect on their ear, they have just start making noise. When they come to the hospital, after we have taken our proper history and examined them, and be able to determine the severity of their hearing, and then which part of the ear is being affected.
Is it the inner part?
Is it the middle
part?
Is it the middle part? Is it the middle part? Is it the inner part? So if it's in the inner part, most of the time it's due to nerve problem. Such problem, you may not need to do anything for them to wear hearing aid or to use cochlear implant. So somebody who is having mild hearing loss, that one can still be socially adequate. Moderate hearing loss, severe hearing loss, may wear hearing aid. Hearing aid is just like an amplifier. You put behind your ear, and it amplifies the sound.
The sound. So
yes, that's it. And then people who have profound hearing loss, these are the people that wear cochlear implants.
Is that one implanted into the ear?
Yes, that's cochlear implant. It has two parts. Unlike the hearing aid, where you just only the external part, but the cochlear implant has the inner part and the outer part. So that's why if you see a child that is not responding to sound before they start acquiring,
I'm even coming to that. So how do you detect hearing problem in an infant or in a child or in children?
The ideal,
especially in babies. Let me put it like that. In babies.
Yes. Now, the ideal thing that is done anywhere in the world, in the developing world, is to do what they call newborn screening, where you test the child, whether the child is pass or fail. If the child should fail the test, you repeat it every 3 months.
In newborn baby.
Yeah. You repeat the test every 3 months. If the child should fail again, and you know that this child is having an hearing problem, you start taking an action on how to start letting the child to be hearing. You have to do what hearing so that they can develop speech and language. Now, again, some people, in Nigeria, we don't do sort of thing. I think this test
it has to be a protocol.
It should come to stay. Yeah, it should come to stay. It should be done in every delivery centers where a child has been born as a newborn child, we undergoes this ear test. You see, that's why, so that for us to be able to reduce our deaf community. We have so much deaf community in this country. I was told to come and implant some hearing here for some people, and then they asked some people from this deaf school to come and see the large number of people with deafness in this country. There are so many. So, and some of them can even be helped. They've been
detected early and then be prevented.
While they are there, some of them can still be, because they don't have money to even, be able to do anything at all.
And I think a mother can actually ask the doctor, request for this particular test you are talking about.
Yes.
Have you done this for my child?
Our first class citizens, people are in this country, you don't know the right thing to do. The right thing that as soon as the baby is born, you need to do an ear test to screen the child, whether this child is hearing or not hearing.
For the assessment and further investigation. Let's talk about sore throat. Because it's just, some people will just tell you have a sore throat, and I'm sure it's not a mild, it's not something one should just overlook.
Yeah.
I think we should talk about it.
Yeah, sore throat.
What causes it?
Everybody used to have sore throat. Sore throat means infection of the tonsils. The tonsils is on the side of the throat. And then all these orifices are not a sterile place. The mouth, the ear, the nose, the throat, the vagina, all these are not a sterile place. You see some bacteria living in them. So by the time your body immunity drops and everything, all these bacteria can attack the normal tissue. Then you start having some sore throat. by the time you have sore throat 1 or twice in a year, it's not a problem. It becomes something of a concern to an ENT surgeon when you're having about 3 to 4 episodes. So we start advising you that
in a year.
Yes, in a year, in 12 months. We start advising you that look, you have to remove this thing so that it doesn't become a focus of infection to other part of the body, like the heart, the joints, the kidney.
The lungs.
Yes. So everybody, can have sore throat, and by the time you can identify that what normally predisposes to sore throat and you're avoiding it, is a very
like what and what.
Well, you have to know yourself. By the time you start noticing that maybe you drank Gary now and then you start having sore throat, or you do this one or do that and you add sore throat.
And at times, if you have catarrh, it can lead to sore throats.
Yes.
Let's talk about nose bleeding. What causes it? Is it hereditary or it comes like that?
Nose bleed. You see it in adult, more common in children and in elderly people.
Because I used to have it when I was younger.
Yes, it used to come in children without anything causing it at all. Okay, there's a particular cause to that in children. You call it idiopathic. And in elderly people, it can come again due to the fact that their artery, the wall is very thick, so it can really break up and leak blood. Okay, so but when somebody nose is bleeding, either in adult or in children, the first one to establish, is there any cause to it, local causes or systemic? And I say local, I mean, is there any problem within the nose, within the sinus at the back of the nose? Because somebody can have cancer of the nose now, back of the nose now, coming to you with nose bleeding, in the late stage, So somebody can have, some children can have some foreign body in the nose, which their parents may not know. You will see that this child nose is always discharging on one side foul smelling, can have blood. If you examine, you'll be able to see that. So somebody can have hypertension, they can take a particular drug. Somebody can have a kidney problem, they can have heart problem.
So all these things can lead to nose bleeding.
Yeah, all these can lead to nose bleeding. So that's why when the patient comes to us with nose bleeding, we try to investigate. But primarily what we do first is that to do some first aid. Most of the bleeding from the nose come from the anterior part of the nose, which by the time you pinch your nose, for about 10 minutes and you put some ice block on your forehead.
Okay.
It may stop the bleeding, because we have different way of stopping nose bleeding. Different ways. Depends on what is causing the problem.
Your advice to our viewers at home how to take care of their ear, nose, and throat.
Right. About there is usually a symptoms signifying disease of a particular place. If you're having a problem in the ear, like something going on in the ear, either it could be a small thing or a big condition going on in your ear, that will be a symptom. As soon as you see these symptoms and you're not getting better, you need to see an ENT. Don't say that you want to put olive oil, anointing oil, breast milk, and all those things you are doing. So by the time you are seeing that you have all this disease, because like now, if you have something in the abdomen now, something in the guts, like somebody having something in the abdomen, like cancer or whatever is going on, and you may have bleeding from the anus, you can have vomiting, you can have constipation, you can have a change in bowel habit. Know that there's something going on.
Something is wrong.
Yes, something is. Likewise in the ear, if you have these symptoms, you have to come. In the nose, by the time you are having so much sneezing and you're having catarrh, it's not solving within 4 weeks, you have to see an ENT. Likewise in the throat, you have a change in the voice, you have sore throat, pain in the throat, you have a difficulty in swallowing, you have a difficulty in painful swallowing.
Discomfort.
Discomfort. So you need to see, and so we can see
investigation.
Yeah, and then because you see the hallmark of it is that the earlier the better you present to the hospital, we diagnose and we can talk about cure.
We've learned a whole lot from our doctor. Thank you so much for coming.
Thank you
on our show today. And I hope next time we call on you, we'll oblige you.
It's the number one answer. Acne, popularly known as pimples, is a very common skin disease, especially among young people. Many acne products contain ingredients that dry the skin, so always use a moisturizer that minimizes dryness and skin peeling. Look for non-comedogenic on the label, which means it should not cause acne. There are moisturizers made for oily, dry, or combination skin.
This is all we have for you today on Health Monitor, your guide to good health. Till I come your way next time, I am Adenike Famujuro Fakayode. Stay healthy and be healthy.